Good evening, everyone, and welcome to tonight's online community forum to talk about the coronavirus and how it is impacting people in our community. My name is Pamela Duncan, Pam. I'm the president and CEO of Metropolitan Development Council. And as always, I'm joined by my good friend and colleague, Twana Nobles, president and CEO of the Tacoma Urban League, with whom we are partnering for this series of conversations.
Thank you, Pam. And tonight's conversation, I cannot believe it, is the 13th in a series of discussions where we are diving into different ways that the virus is impacting Tacoma and Pierce County. And tonight, I'm excited that we have a returner. We'll be talking with Dr. David Hirschberg about what is happening with the virus in Pierce County and across our state. We'll continue to be here for the community throughout the COVID-19 crisis with new conversations every Monday evening at 5 p.m.
The most important message throughout the series of conversations is that there is hope for our community. Our focus is to create space in each meeting to talk about resources and things that we can all be doing to help get us through this pandemic. Throughout tonight's conversation, you can submit questions to be answered by our speaker, Dr. David Hirschberg, using the Q&A function in Zoom. We cannot promise that we will have time to consider every question, but we generally do a good job of hitting all of the questions.
And also, I want to add as a housekeeping matter, for the security of everyone on this call, everyone's mic has been muted. We are not allowing everyone to share their faces on video. We've also disabled the chat function. So submit your questions to our moderator through the Q&A function in your Zoom.
So before we get started with our questions, I'd just like to introduce Dr. David Hirschberg. He is the founding member of the RAIN Incubator. And David says years ago, he returned to Tacoma with a dream of starting a life science incubator that would educate students, grow jobs, and turn out startup companies for our region. And that's RAIN. It's the recognition of that dream. Dr. Hirschberg's strength is in creating innovative spaces where people can collaborate, develop skills, and invent useful skills. RAIN is about rapid prototyping of ideas, demonstration of technology to investors, and solutions to local problems. RAIN is about fundamental work from the bottom up. We want to be Tacoma's hometown innovation center, a proving ground for technical expertise. We are developing human capital for the community. Dr. David Hirschberg is also a neuroimmunologist and an epidemiologist, and we have invited Dr. Hirschberg back so that we can talk about what we are seeing happening now with the coronavirus. And so now we will begin with our questions. So Dr. Hirschberg, it's been a while since we last talked. You are actually our inaugural guest. What have you been working on recently that is related to COVID-19?
Well, it seems like I was just here yesterday. We have been working long hours. So since we talked, we've mainly, in the first part, focused on the tests that we're doing. So you may or may not know, we're doing a lot of testing in the community, testing sewage and finding the virus there. And we've expanded the program, so it's really an early warning surveillance program. And I think I mentioned last time that that the virus is in feces too, because it's the ACE2 receptor is there in the gut. And so it's a good way to find it. In addition to that, we have developed molecular tests, so we can actually test for the virus in throat swabs or in sputum. And then we can also look for antibodies, circulating antibodies in the blood. So all these tools for us are public health tools. that are really, we're not really trying to replace hospital labs. We want to look at population data, where the virus is and where it's spreading. And of course, a lot of our effort is training individuals here in our community how to do this work, not only so that it can be a community resource or a resource here in Pierce County, but also hopefully they're going to go and get jobs in this field, in the medical field and the environmental field after this COVID-19 pandemic passes over us.
Mm-hmm.
I also have a question. What are your thoughts about the rate of spread? COVID-19 is, I've seen the numbers 121, 97, I think 60, but we definitely reached a record high just a couple of days ago over the weekend. But tell us a little bit more about your thoughts about the spread of this disease.
Yeah, so I like anybody in public health should be alarmed at these numbers. This is the consequences. What we're seeing now is what decisions we made, decisions our leaders made a month ago. And so we, by opening up, by not really putting certain systems in place that are really essential to combating a pandemic, such as testing, contact tracing, and isolation, and just sending people back to work, we've kind of, in a sense, set ourselves up. And so the numbers that you're seeing, you know, if you were looking at numbers a month ago in Arizona or Louisiana or Florida, and we're starting to get alarmed, our numbers then were very low, but it was really hopeful to think that that wouldn't happen here as this wave kind of came crashing over us. So I am alarmed. We should be very alarmed right now. And hopefully our leadership's going to really take some actions right now to really prioritize individual health and safety.
So I actually have a follow-up question to that. You mentioned several southern states. Why, in your estimation, why is it that there was a surge in those southern states?
Well, it is, I mean, it's the original surge, as most of us know now, it came from the East Coast. And so certainly the high dense areas, especially New York City, and the outflow from that city really is where we're watching this track through the country. So the main drivers of the virus are density. So in dense areas, you're going to have the fastest spread. In the states that have the highest populations, you'll have fast spread. But other things driving that are some of the choices we made. So the lack of leadership at the national level, really determining when to use face masks, when what levels of PPE people would have. And then of course, opening up restaurants, churches, casinos, places where we gather, and really not in a sense, managing the social distancing, and so not taking it seriously. So those states that really were the most lax are the ones that are unfortunately paying the price now. And the states that did shut down, we did do that on the West Coast. We had a scare, we shut down, and immediately you saw the virus stop. The problem was we opened up again without putting the proper things in place.
Speaking of proper things in place, there has been a lot of criticism about masks and the effectiveness of masks, about masks being in a proper place, about the types of masks being in, you know, proper environments and who should use them. Do you mind sharing with us a little bit about the effectiveness of wearing masks to slow the spread of the virus? And how would you, you know, what is your recommendation for addressing this issue?
Yeah. So masks are effective. And I know there was some confusion in the beginning. Again, the message from public health was never that masks weren't effective. Our first responders wear them. And so it's clear that they're effective. What we were concerned about, and many people at the CDC, were that this would make people feel so safe that they violate the 2-meter rule. And so that was the concern then. But clearly in areas where you have to be closer than 2 meters, whether it's Safeway or your neighborhood grocery store or in any kind of place, the masks are effective. They're more effective, and specifically for the people who are potentially infected. So if you're sick, wearing a mask, even if people around you aren't, is very effective in minimizing the spread.
Thank you.
So, Dr. Hirschberg, the director of the CDC was quoted last week saying that if we all wore masks and returned to more social distancing for 4 to 8 weeks, we could handle this virus in this country. So you've just mentioned some things about the mask. What are your thoughts about this statement? And then I have a follow-up question for you.
Okay, so first of all, I just want to say I've met Dr. Fauci and Redfield of the CDC, and I know them quite well. Believe it or not, they don't disagree on everything themselves, but I think the statements, the leadership that they've shown is good, and it fits in well. I mean, we know that masks are effective. Masks by themselves, it's like I call it like you're wearing your armor. So there's many things you have to do. You have to wash your hands often. You have to stay as far away from people as you can. 2 meters is good. And a mask is another piece of equipment that allows us to kind of complete our armor. And so I can't stress it enough that all these things working together with good testing, with contact tracing, with isolation of people who are suspected to be infected, is critical to basically flattening and lowering the curve. The virus just can't spread when you put these things in between it and another person.
So the follow-up question, this morning on the radio, I heard a segment about how Rwanda in Africa has been fairly successful in containing the spread of the virus, and that what they are doing is very aggressively testing people, that even with their limited resources, they have managed to keep the virus under control, if you will. And so they have a total of 1,200 cases in the country, and compared to, it was either Ohio or Indiana, a Midwestern state that has about the same population. They have about 1,200 cases per day. So yeah. What are your thoughts about how, what you've observed from other countries that have been effective in reining in the virus and the spread?
Yeah, I mean, there's clearly good examples everywhere. So obviously the biggest threat is to be overconfident going into anything. And I think if you saw the New York Times articles today, even the most of Europeans have really said, although they're fighting it, they were able to bring things under control, and their lives, by the way, are going back to normal. I think they are very open now about the mistakes that they made. And I think, countries that have limited resources, first of all, the virus has not reached, it's really reached maybe 0.2 or to 0.4%, maybe 0.5% of the world's population. So it still has a lot of fresh fuel to go after. So I think what I see to some countries that have managed their limited resources is basically, first of all, not going into this overconfident and realizing that there's a lot of things people can do, even here in the United States, where we're doing such a terrible job of managing it. Again, changing behaviors, wearing masks, washing your hands, and many countries who have dealt with many other infectious diseases and really have challenges are already trained in things that we're just learning right now. And so I think it really depends on a centralized government and really having a good public health system. And even with limited resources, you can do an excellent job of controlling this virus.
So do you think we are headed in the right direction with testing now?
We are. We're not doing it fast enough. I think this should be an absolute priority. So we need to be testing many more people than we are. And we need to have good data that's available to show how these tests are performing. I think we have outsourced to a lot of companies, and there needs to be better standardization so that we can test which tests are most effective and cross comparison of the test results. There are some concerns that we're allowing a lot of false negatives, and those individuals, once they're deemed negative, can go on and spread the disease. We're only testing people who are suspected to be positive. We're not doing enough testing of asymptomatic individuals, which we know is a huge spread in our community. Mm-hmm. And so these are, again, these are fixable things. This comes from good leadership and prioritization of resources. And, you know, in the past, it's really been done at the government level at the top to do this. But even then, communities really can dictate this and really put this in place.
I have an additional question about testing. This past weekend, while attending the Black Collective meeting, Will spoke to us a little bit about what he learned down at RAIN. And he talked more about, I think, testing the gut. I may have this wrong, but I tried to listen. So just, or no, maybe whatever this, you're the doctor, so I'm gonna leave that to you. I'm gonna use my regular non-doctor language.
Yeah.
But the difference between testing in the nasal area and testing, you know, towards the back of the throat.
In the throat, so yeah.
Maybe talk to us a little bit more about some of the other testing that is picked up in other countries and countries that have stopped testing in a way that we're still testing here in the US, and what might be more effective as far as testing the virus.
Yep. So right now testing is, you know, originally you heard about this nasal pharyngeal swab that you stab this back through your nose. Actually, what you're doing is stabbing back through your nasal passage to the back of your throat. And so the virus is a respiratory virus. It basically infects through usually through respiratory tract, but the back of the throat, right at the top of the lungs, is actually a very good, effective way. The virus likes to grow there, and it's been shown that you actually spread the virus more efficiently through talking, yelling, singing than you do through the nose, sneezing, and so that's why, from the virus's standpoint, it is much better to be in the back of the throat. And we find the virus there for longer periods of time. So it's a much more effective way to measure whether somebody's infected. In the nasal nares, this is the drive-by, you swab the inside of the nose. That is effective, but it's infective people are infective through that, or they'll find virus there for a shorter amount of time. And so the throat has been shown, and sputum is actually even a better way. If you can produce by like a cough and spit into a tube, that's also a very effective, easy way, and it's cheaper to collect that sample than doing the swabs and having somebody monitor you doing it correctly.
So we have some questions that are being posted that I'm going to pivot and ask a couple of them. These are all very, very good questions. So one is, shouldn't we follow social distancing, hand washing, masks, that is, all measures that help until we have a vaccine? It'll take many months to reach herd immunity. There will be essentially fresh fuel for a very long time.
Yeah, that's a great question, but it should also be the statement that our leadership gives out. Absolutely. I think that's exactly what we should be doing. We should be doing everything possible to minimize the spread of the disease. And I think we can be very effective. We can just go back to work, but we have to maintain everything that creates a barrier between you know, a person and a person, if a virus is going to jump that barrier, you need to create barriers.
I want to ask a question about education, but I'm going to, just so you can be thinking about that. And I'm a school board director. I have 3 kids that I have to make.
Yep.
Well, I won't disclose. I've been kind of disclosing it, but I've already made a decision for my kids. But I do want to ask a question about education.
Yep.
But I want to know, looking forward, what do you expect will be some of the major developments in fighting and managing COVID-19?
Oh, well, I'm gonna take the education piece. I know you want to do that for 20. So because I worry about that a lot. I see the kids. You know, I think the worry is. Excuse me a second. Excuse me. I've been talking all day. You know, my concern is the kids and the lost opportunities on education. I can't imagine what it would be like when I think of how much of my life, my social, you know, being a kind of a nerdy, geeky person, I developed a lot of my social skills through school and interaction. And I just don't learn well on 2-dimensional screens. I need interactions with people. So I understand that. And I think we need to figure out ways through this to build education. You know, I'm hoping that there are ways we can do this and we can put students together. You know, I worry about the teachers, you know, being placed in this. And I know there's a lot of issues with trust right now because administrations are under pressure to get schools and kids back to work, kids back to school. But the reality is, if we can't guarantee safety, you know, it's a big concern. So I don't know what the solution is, but I know there's a lot of creative people out there. And I think education has to be a priority through this. We've lived through wars. We've lived through people who went through years of oppression. And the one thing that has to happen during all these challenges is education has to continue. You need to educate young people and develop their minds so that they can do a better job than we did in doing this. And so I think it has to be an utmost priority.
You.
Did you get all of your questions answered, Twana?
Yes, I mean, I do feel like in a lot of I'm always interested in from the scientists, kind of the things that we can predict about this virus developing and managing this virus. And David, that can be anything from folks already predicting we may be under another stay-at-home order, or predicting if we pay attention to the science and look at what's happening elsewhere, we can determine where our state might be landing in a few weeks or in a month or so. But if there's anything else that you want to share about what we can anticipate based on major developments now, or major developments that we may be facing in the future.
Yeah, so as a scientist, I mean, if we do not change our behavior now, if we continue to go the route we're going, probably the only option is going to be to shut down or to suffer really a heavy toll in our hospitals. And this is, I want this to be not the outcome. I hope I'm wrong, but like I tell a lot of people, hope is not a great strategy. You can see what other countries are doing right now. You know, pick any country that is, you know, Germany, Korea. These were countries that were hit very hard. They admit mistakes were made, but they are also going back to work, and the people are being safe. And again, it's the basics of having good testing, contact tracing, and isolation. Those are the basic things. And so we can do this right. We likely will have to shut down again, or we should actually shut down if it means the safety of people. That has to be above all. I can't ask anybody to go back to work if I know we're putting them at risk. And we need to solve all the other problems. You need to feed people. You need to guarantee jobs. It's a drop in the bucket to risking people's lives and the possibility that people who could contribute to our society are just being wiped away. And I don't want to be part of that society. So I'm saying this as a person, not as a scientist. I can better do my job if I know my leadership is keeping my people safe. And so what I do ask is that when we go back to work, when we restart, we do this right. We follow the examples of countries that have done this, and we don't do this again. We don't do this for nothing. And so, I can't be more adamant as somebody who's been working 60-hour weeks. I am just aghast that you're going to ask our healthcare workers and our hospital workers to go through what people have gone through, either in the past a couple months ago or in cities like New York. It shouldn't even be a consideration.
Right. I just have a really quick follow-up. Would you say that we are still in the first wave or at the beginning of a second wave? I mean,
so anybody who's done surfing, a lot of people don't do surfing around here, but just, when, if you have two waves, there's a first wave and a second wave, and they combine, it makes one big wave. And so I really don't know if there's a first wave or second wave. I don't think our first wave ever ended. So I think we have a giant wave coming our way. And again, we will get through this. We will, I'm an optimist. We just have to do it right. We have to prioritize safety, and we have to get the equipment and people trained and get the testing in place and test everybody who needs a test, not just people who are positive. And then do this right. And we have plenty of examples, and we have plenty of trained people in this country that are willing to be, to basically give their information to our leadership.
I have several questions. The one that's, I think, a follow-up to what you just said, especially when you talk about the wave. And so now we've got a new term, just like we were talking about flattening the curve.
Yeah.
But we've all heard people say, I can't wait for us to get back to normal.
Yeah.
And what do you say in response to that?
Yeah, I don't think I liked normal before. I mean, I used to lose a lot of sleep because I worried about pandemics. I mean, these are things that are predicted, just like, everybody should have fire insurance if they have a house. This is insurance that we build in. Our public health is our insurance systems. And again, the virus really, I've said this, the virus really didn't cause a lot of the pain and suffering. It really just exposed what was there beforehand. So the disparities that we have in our healthcare system, the fact that some people don't have insurance and others do, the fact that people have nutritional differences, that schools are funded at different rates in different neighborhoods, all these things the virus just grabs onto and leverages. And so eliminate those, solve these problems in our societies, create equity and inclusion, and really do it, not just with pronouns. I mean, really do this. You're going to take away the fuel that this virus uses to burn.
So, Dr. Hirschberg, especially early on in the pandemic, I was just inundating you with questions all the time. I was texting you different questions that some I want to go back and revisit. But the first thing the thing I want to ask right now is, what is the most significant thing that you have learned or that science has learned about COVID-19 at this point?
Oh, that's a good question. I am learning so much. I guess I'm learning how much I don't know about it. It's a much more difficult virus than we thought. And I have worked on SARS and I've worked on MERS, and this one, it's very infective. It's not as lethal as the viruses that we trained on. So Nipah viruses, Ebola, all these really bad viruses. I was surprised that a virus that isn't as lethal as all those can be so devastating and disruptive. So we underestimated it in a lot of ways. I'm also surprised that people aren't developing antibodies. Young people aren't developing antibodies in the classic way we've been trained. And so it gives me concern for how effective these vaccines might be that are being promised very quickly. I think, but then there's been some other things that are interesting. If you downregulate the immune system with just some very reasonably priced, drugs that are generic, cortisones, you can actually save a lot of lives. And so that's also very interesting and surprising. So I think there's a lot we've learned about it. I think we are good at saving lives now for people that do get into the hospitals and the ICU. But I'm just surprised at how this virus has moved through the community and where it crops up. We have a lot to learn.
So what have we learned about folks who are asymptomatic? Would you talk a little about that, and folks who, is that still an issue? Folks are asymptomatic, they test positive, and they don't know that they are positive.
Yep.
Unless they've had the test.
Can I add to that? Because I've heard folks who, for good reason, want to be tested because of, as you mentioned earlier, there have to be specific symptoms to be tested. I've heard folks say, then I'll just go and make up symptoms so I can get tested. So maybe, speak to that as well, as folks who are asymptomatic, but also folks who may be asymptomatic and want to get a test.
Yeah, I believe that everybody who feels they need a test should be tested. But I think that's really important. Again, that in a way, it's a presumptive positive. If I think I'm sick and I take a test, then there's that can change the prediction of the way a test works. It's just the way these are set up. But I think what we really need to do is test asymptomatic. So first of all, there's not everybody who feels sick ends up going to the hospital. They don't end up being tested. Not everybody has a car that they can sit in and have the air conditioning going for several hours while you go be tested. So I think that community testing is really important. We need to know there are a significant number of people, it may be as high as 30%, who have the virus, who may contract the virus and be infective, and then can spread it to people at risk. And so that's a concern. We need to figure out where it is. So I think that the priority has to be to get enough tests so that we can test everyone. And then you need to test a subset of people randomly, and everyone, not just, like I said, not just people with cars. You got to test everybody to find out where the virus is in the community and how it's circulating.
So a follow-up to that, do we know for a certainty what the that period of time is, the prodromal stage between when somebody gets infected and they become sick? How can we know that if there are folks who are asymptomatic?
Yeah, so there's a number of articles that are coming out from endemic areas that had studied this. So in China and Italy, Spain, where they really looked at it, at New York. And so it's, as a scientist, you can never say exactly. There's variations in people. But it looks like people become infective, or you can detect the virus 2 days after infection, as early as 2 days. And with the peak being about 8 days. And really after 14 days, it's most people would go negative in that experience. But there are individuals who can be positive up to 19 days. Now, you have to look at positivity, a detection of the virus, and whether they're infective. Those tests have not been done to a large extent. But in general, we know that people are infected probably as early as 2 days, and in some individuals, and so we have actually seen cases where people are asymptomatic. You remember the outbreak of University of Washington students that just happened, where I think it was up to 110 students were positive, most of those students were asymptomatic. And yet they were spreading it through a fraternity house or among fraternities in Seattle. So again, these outbreaks, the outbreaks that are happening now in Germany, where things are basically under control, they're still outbreaks, but it's mainly this community testing that is going on, and really looking for people who are asymptomatic, identifying them, and then immediately with either software or contact tracing, finding out who they've been in contact with.
I have so many questions, but this first one might be easy. Should we be communicating the quarantine time period is not 14 days, but 19 days is my first question.
So that's not an easy question.
Okay.
Those are all difficult questions. It depends how you do it. Again, if you know you're positive at day 14, like say you're positive and you wear PPE, we know that there's already CDC guidelines that says healthcare workers who know how to don PPE and manage social distancing can go back to work after 14 days. And so so you don't necessarily have to be completely viral negative. Remember, you're trying to minimize spread. And so if you're taking all kinds of precautions, you can still do that and go. I think the vast majority of people, I would say between 2, maybe 4, and I'm more to weight it towards the early part. So if you could know you were positive at day 2 and you stayed isolated from 2 to day 14, you would probably, if everybody did that, even if people went out and possibly were infected, the R0, the measure we do use this to keep show how fast the virus is spreading, would fall below 1 and the virus would snuff out.
So where are we right now with the R0?
It's higher than 1 in Washington State, unfortunately, and Idaho and places are all around us. So we're not doing a good job. The cases are going up. You're going to see record cases that are staggering in the next few days that are going to go up and up and up. And that's just the biology. Remember, what we're looking at now is decisions we made maybe 2 weeks and 4 weeks ago. And so even if we stop and change our behavior now, it will take 2 to 4 weeks to really shut things down again, shut the virus down again. And so those are my concerns of what's going to happen going towards the hospitals now. Are we prepared? I think the hospitals have done a great job of preparing for what's going on, what's going to come. We have enough PPE. We have great trained staff. They know how to treat people now, but the questions really is, do we really need to test that system right now? Are we doing enough as individuals to minimize that spread and really flattening that curve so that those hospitals don't see the surge that is being predicted?
Dr. Hirschberg, I really want to thank you because I know it's a lot for you to answer all these questions, but it is helping all of us significantly. And so there's a question in the chat box, but I want to add a component, and this is a little bit selfish, but I know it will help other families out there. So I have 3 kids at home who continue to ask me, can I go cliff diving with my friends? Can I go watch a movie with my boyfriend? Can I go to youth group with my friends? And I keep having to be the health conscious mom who's saying, no, we're staying home. No. I do, like my kids we have one family that we know quarantine well, is safe, but they're pushing me here, Dr. Hirschberg. Now they want to take it to the next level. Like, this family is safe too, I can stand, they're pushing back on, it's just a short-term sacrifice. And my 14-year-old told me yesterday, Mom, this is no longer short-term. This is becoming long-term. And I told me to wear a mask, and I'm wearing a mask. And the question in the chat is about mask, and yes, you already spoke to whether they'll keep safe or not, but just the hygiene of masks. Is it enough for me to say you can still socially distance yourself around this person and wear a mask? Is it more care of the mask, certain types of masks? The question in the chat is, we hear lots about the importance of wearing masks, but very little about care and maintenance of the mask. Would you please speak to how they should fit, how we remove them, the frequency of wearing and washing them? This person has several masks hanging on their rearview mirrors. And I know I have lots of masks hanging all over our house, but help me with my children. And is PPE enough if they want to go watch a movie outside with a friend or should I keep saying no? Because I feel like the mean mom, and
Yeah.
but my kids are healthy.
Yeah. Well, I've also seen people Cloroxing their Amazon boxes before they bring them in the house and things like that. I really don't, I mean, the virus does not live very long outside of our bodies. So it's really, the way to spread it is direct contact, talking at somebody, or shaking hands. So, I think if you have responsible kids, cliff diving, probably it has its own dangers, but probably not spread of COVID is one of them. Riding your bicycle with a friend, being outdoors, walking around, going on a hike. These are activities that are perfectly safe. If you maintain a social distancing and a mask, you said about masks now, double stitched masks that provide that. I think, again, you're looking for a barrier. So, a scarf or something that you can see through is not the barrier. But I think masks provide, basically what they're doing is blocking a lot of airflow. So even if you sneeze with a mask, it's going to come out from the sides. Again, if you're doing surgery, bad. But if you're blocking a full-on sneeze or cough to somebody that's right in front of you, masks are very effective. So washing hands, really being aware of where you are in relation to your friends. And then the other thing in terms of isolation, if two families isolate for a couple of weeks and then they decide to go together and be together, they're probably pretty safe. There's not like a virus spontaneously evolving there, right? So it is, I think really, people need to think things through. If you want your kids to be with their friends for a month, a number of parents could get together, isolate the kids for a couple of weeks, and then put them together, and then don't let anybody else come in contact with them. And I think that's a perfectly safe situation.
So what about...
My kids aren't listening, so it gives me some time to digest that. Because then they're going to be telling me, well, Dr. Hirschberg says.
Yeah, there you go.
Right now.
Yeah.
That
was what I thought too. So what about testing for antibodies?
Yeah, so that, obviously fell out of favor, right? You heard a bunch of stuff and a lot of these tests didn't work. Internally, we've developed an enzyme linked immunosorbent assay at our work, and it's working very well. So it's called an Elisa test for short. And it has several advantages, and we mainly use it to compare other tests. But I do think that there will be other classes of tests. You will hear something called neutralizing antibodies very quick. Many people are rushing to develop these tests. And these are a special class of antibodies that when they bind to the virus, they block the virus from dividing or being infected. And so I think that the tests now, we're learning that can't just detect the virus, they have to stop the virus. And those are very effective tests to look at. And many people who are fighting off the disease have this. So I think antibodies still are going to be important. They're not as important at the beginning of a pandemic because we probably have to see the virus several times before we develop the right kinds of antibodies to protect us. And that's very equivalent to, let's say, a childhood vaccination where we vaccinate our children and then we boost. And what you do is just because, like, you're not protected after seeing the vaccine once, you have to have 2 or 3 vaccines. We're probably going to be exposed to the virus, or we're going to have vaccines that are going to do this. And then I think antibodies will become much more important. From a public health perspective, if I find circulating antibodies in a person, I know for sure they've seen that virus. And so that gives me information. I don't know if they're safe or not. I don't know if they're protected, but I know that person in the community has seen the virus. And that's an indication that the virus has been there or was there, and this person has seen it. And so that's a very important piece of the information to people that are trying to generate data so that our leadership can make actionable decisions.
So I have several questions, and I also want to remind our listening audience, if you're on Zoom, you can submit your questions in the Q&A box. And we have a couple, and there's one that's very important. I want to save it towards the end of the conversation, though. So, David, when you talk about the antibodies, I'm also reminded of a question, a conversation we had earlier on in the pandemic. Are there different strains of the virus? And then how, I'll let you answer that first, and then I'll have a follow-up question.
Yeah, for this particular virus, I mean, there is one main virus. It is evolving. The virus is made out of RNA. And so it's only a single strand of RNA. And so we have two strands of DNA. And so it can change, and it does change, but it's not evolving. If anything, it may have evolved early to be a little bit more infectious and maybe a little less deadly. And when you think about that, that's, those pieces of the virus that can do that, if it can be less and less deadly, it actually benefits the spread of the virus. And we have 7 right now coronaviruses like this that are alpha and beta coronaviruses that have jumped into humans before. And many of those do not cause bad disease. They, in a way, have evolved to be less infective. So you've heard of OC43. That's a type of childhood flu almost. It's a seasonal flu now. It is not necessarily deadly. It's evolved to kind of be less deadly. So this is really still one virus. There may be a little small flavorings of it that make it stronger or less. But in general, it is changing, and it may change significantly over time, like over the course of years. But this is essentially the same virus that erupted in Wuhan in probably December and January.
Mm-hmm. And then to that question about the masks, the last part of that question was, I keep several masks on my rear view mirror. Is this okay? Yeah. Is that okay? Or is there going to be, especially like if it's a medical mask, could the sunlight do something?
Yeah, we should talk. Yeah, I think any mask is effective, and it's kind of as effective as how close it is to your hand when you need to put it on. And so if you put it on the rear view mirror of your car, and that prompts you to use it when you need to, if you need to go into a place or come in contact with somebody, I think any mask is more effective than no mask. And so, but you should, just be anything that's on your face all the time, and we have to be worried about other things besides coronavirus. And so just like you need to, clean out your gym locker every now and then and wash things, probably a good idea to wash this with soap and water. But the coronavirus itself is not going to linger in the mask. It's probably other things like that, are going to grow in a wet, moist area that you probably don't want to be breathing in. Okay. So, yeah.
Okay.
Thank you. That was a really good point and really helpful. I have a bunch of masks that I need to go drop in the laundry, but thankfully we have.
There you go. Yeah, everybody should have 10 masks. They should have them in your pocket. You should have them where they are. And then you should also have, a little hand sanitizer. I wear one right around my, on my belt. And that way I can squirt stuff, I accidentally touch something, or I just feel, oh my gosh, I should clean, that getting in the habit of washing your hands. When you enter the house, if you can set up a wash station or something, a basin with water and soap, when you come into the house, just to get into the ritual of it, I think that's a critical thing to do. Just get in a habit of washing your hands several times a day.
Are we okay with any kind of or brand of sanitizer? And then there's a question from the audience about, favorite material for masks. But are we good on all sanitizer? Because a lot of them, like the Urban League purchased PPE kits came with sanitizer. Yeah. I use it. Do we need a certain brand? All of them good?
Yeah, it's really not. Soap and water is probably the best thing for it if you have soap and water. If you need, other than that, a sanitizer with 70% like isopropyl alcohol or something like that, and hopefully some kind of moisturizer so your hands don't get dried out. I think that's enough. You really don't need that. I have seen some stuff with methanol, and there's some concerns with that. So you really don't want to be using that. But any kind of alcohol, distilled alcohol, you know, you've seen a lot of the distilleries selling stuff in the breweries. That's really, I think that's effective enough. But soap and water is above all the best you can do.
Okay.
So one more thing I wanted to add. Sure. I wanted to add one more thing about washing. I think we talked about just that, what types of PPE. You know, for me, I still feel like, I know people want to wear N95s. I really think if you're a first responder, you know, the best PPE should go to the first responder. Anybody who's coming in contact with people, they need those. But, you know, a cloth mask, a mask that has kind of 2 layers of material, those are very effective, and I think we should just have lots of these around us all the time. And then, of course, there are disposable medical masks that are just really just, you know, kind of very basic. They're not N95, and they're very effective. And so as long as our first responders have the best PPE out there, these are more than enough to be effective. And anything is better than nothing if it's double-walled.
Okay. One more question pertaining to masks. Should people be wearing the mask if they are exercising outdoors?
Oh boy, that's a tough question for me to answer. I personally don't, I'll tell you that. I think if you're outdoors, you know, as long as somebody is not in contact with your plume breathing out, as long as you're taking steps to stay away from people, I have not seen studies of people spreading virus in an open space like that. It's just, the virus is really too fragile. So, you know, I have not seen any good studies that have shown that. I think it's mainly indoor spaces. It's, you know, if you need to be aware that you need to be away from somebody with, you know, sometimes a mask helps you do that, then I think it's something you could wear outside. But I don't, you know, I don't think, as long as you're not in a crowded space, I think, you know, having that mask handy is probably more important.
And so moving forward, what do you consider to be the next major development in fighting and managing COVID-19?
Ooh, good question. So I'm very optimistic. I think that we have some of the brightest people in the world working on solutions right now. And I'm very optimistic. I am, you know, a humanist at heart. I do believe that you know, the best minds, the best people, our best intentions will prevail. And so I am excited about new diagnostic techniques that will be coming that enable much more rapid detection of the virus. I think there's some really good innovations with contact spreading applications and the training of just all of us to really understand who came in contact with who. And I think for treatments, there's a number of treatments. I do believe vaccines will be here. There's many groups working on them. If you see the early reports, the very first reports are very promising about people being able to develop antibodies after being vaccinated. But I think also the treatments, the techniques, and I think a lot of innovations in our workplace are going to help make it safer, not just for COVID-19, but for influenza, which we have to worry about in the coming flu season. And I recommend, I am a bench scientist, but I recommend to people, you know, do not neglect your health. This is not the time to neglect vaccination against other diseases, to take every step possible to keep yourself healthy. You know, if you are thinking might be the time to stop smoking, this is the time to stop smoking and make yourself healthier to not just fight this disease, but others, to increase your exercise, be healthier with what you're eating. You know, these are the things that really make you stronger, not just for this virus, but everything. And so I'm optimistic that, you know, we have this time to really prioritize and to really look at what is going to be important in our society.
I don't know if you want to tackle the final question in the Q&A box, or I asked all my questions.
I'm getting nervous.
Well,
so
Well, there is one more, and that is with fall just a couple of months away. What are the next big challenges we face in managing this virus?
Yeah, so obviously we have our hands full right now. I do think we will get this under control, but what I think going forward is that we will have to really be much more prepared for any kind of response. Not just from, I think, well, COVID-19 will be with us for a while. It's not going away, it's here. And so it becomes one of the things that is, we have to always be watchful for and protect people against. But we have a flu season coming up, and already there's reports the virus this year, that the flu virus is going to be an H1N1 variant. We need to formulate a vaccine against that. And now, in addition to COVID-19, which is an extremely serious disease, we have influenza. We have a regular flu season. So now we have it's just one more thing we have to add. But I think being able to develop better diagnostics, this has been a good lesson, because we will have more pandemics and outbreaks in the future in agriculture and also in human populations. And we need to we have the technology to do the surveillance, to test for these things, to know when there's early warning and these things trigger these alarms. And so I think it's something that our leadership going forward will have to build into that. And this will be more funding for our public health organizations that are really tasks for really making all of us healthy, not just wealthy people, but really everybody in our society has to be equally treated in this area. And I think that's really what is going to be our work to do going forward. We need to really focus on this and really fund these agencies that have frankly been underfunded and have been, in a sense, hollowed out in the last 5 or 10 years.
I think, David, you actually opened the door for the segue to the final question.
Uh-oh.
And that great question that was posted: politics seems to affect public health far too much. How can we counteract that mentality? Being safe should not be reliant upon your party alignment.
Boy, I hear that. I am, as a scientist, I'm not a good politician. There are scientists that are good politicians, but not really. If you look in our Congress, there's very few scientists. There's zero scientists, I think. I am frustrated by being able, I feel like I'm going to a diner. I hope I'm not apologetic. I'm insulting anybody who doesn't like this food, but I feel like the two choices on the menu are liver and Spam, and I don't like either one of them. And I'm not given, this is, in a sense, it's a false dichotomy to make me choose between a party affiliation and my health or my fellow person's health. And so, I think that I don't like the politicization of science. I'm supportive of any politician, any party that supports science and reasonable thinking forward. And I think demonizing the very people that are trying to make a difference, to work hard, to really save lives, is in the name of politics is crazy during this time.
Thank you. I think we like to end, the session talking a little bit about hope for the future, but you already told us where you stand on hope as it relates to this virus. So,
well,
are there final words that you would like to leave us with that are not relying on hope? Yeah,
so hope is, in addition to hope, there are a lot of people working very, very hard to solve this situation. In our public health department, in our county level, there are many people working long hours. And, I think that we are going to get this right. We need to admit that we've kind of screwed up and didn't do a very good job of this, and people have died as a result. But the roadmap is there. It's a hard choice. I am going to support those leaders that do it. From my standpoint, I want to go back to my lab and generate data. And I don't want to tell people what to do with the data. I want our leadership to take that data and make the decisions they need to make and balance that against, you know, whether we need to put people at risk or not in order to save jobs or do that. But you've got to have the data in front of you if you're going to make those decisions, and you have to be accountable if you're wrong. And I do think there are people that I see young people mobilizing, stepping up, and I am hopeful, you know, that we are going to get it right, but I know we are going to get it right too.
There was one last question I thought was pretty interesting that was posted, and that is, David, have you seen that there are folks with different blood types that are affected differently by the virus?
So I've seen the papers, and I know there's some discussion on that. I think that needs to be studied better. I mean, this goes back into the whole discussion on personalized medicine, that, you know, if we understood all the genetics and we had all the markers, we probably could do, you know, definitely find people who are more susceptible and less susceptible. But right now, I think a lot more work has to be done on a simple thing like blood type. I think there are markers that predispose people to react a certain way, or their immune systems to go a certain route when they're faced with a virus. But I don't think that's enough right now to really pre-sort people or to determine. And like I said, if it was as easy as blood type, we pretty much already have that solution.
Mm-hmm. Yeah. Thank you. Thank you so much for making time to be here with us and answer questions and help us to have a better understanding of what you are seeing and what scientists are seeing as it pertains to COVID-19. So again, we thank you so much for being here. And do you have anything else that you would like to add before?
Well, first of all, I really appreciate what you and Tawana are doing to kind of educate the community, because I know there's really a lack of trust right now, and I want to encourage people to seek medical help if they're not feeling well. You know, do not pretend that this is not a serious threat that we're facing. The other thing is, if there are young people out there that want to learn more about the science, if they want to come to RAIN, we will figure out a way to do it. Get in touch with Pam and Tawana. You guys give them my phone number, my email, and we will figure out a way to bring people down. I would love that. I would love a science teacher to come down to RAIN, and we could kind of teach that person something that they could take back to their classroom. Or we can figure out this fall how to do a class maybe at RAIN, where we can provide a safe area where people could learn. But we've got to figure this out. I want people with ideas coming down. I don't have any answers to this. I want to try to figure out a way to really figure out, how do we do experimentation? How do we educate? And if there's somebody that wants to learn these techniques, the strengths and weaknesses, they want to learn enough so that they can make them better someday, I'm willing to teach and figure out a way to do that. Or I have plenty of other people that can teach where we are too.
Thank you. Thank you. I would like to, just before we close, just announce that there are masks that are available for folks who are in need of them. And if you are in need of a mask, or if you know someone who is in need of a mask, please reach out to us. You can reach out at impact@mdc-hope.org, and that'll also be posted in the chat box. There are plenty of resources out there. Tawana?
I agree. We are particularly right now, since businesses have begun to reopen, we are getting PPE to small businesses. So I agree with Pam. We also are trying to make sure we have PPE for community members, but because folks are working right now, Tacoma Urban League does have thermometers en masse that we will begin sending out. We kind of have prioritized a list of businesses owned by people of color, micro businesses that we will start with, our Black Business Directory. So we kind of have an order or strategy, but folks are welcome to contact us to be added to our list.
And so between, definitely between the two of us, so we are prioritizing those individuals who are low income. If you know someone who's in need of them and fits in that category, please reach out. Thank you so very much. Thank you all for tuning in to our 13th episode of Straight Talk, Community Conversations about Coronavirus. This has been so helpful. And once again, we are your hosts, Twana Nobles from Tacoma Urban League and Pam Duncan from Metropolitan Development Council. Thanks again to Dr. Hirschberg, and good night, everyone.
Thank you, Pam. Thank you, Twana.
Thank you.
Night.
Bye-bye.
Good night.